Every joint in the body has a specific range of motion. It is the maximum amount it can move in any or all of three ways: front to back, side to side, and in a transverse manner, depending on the nature of the joint. Putting joints through their normal range of motion helps prevent stiffness and loss of function. When a client cannot do this himself, for whatever reason, a nurse, a physical therapist, or other caregiver must do it for him. The process of moving a client's joints through their complete range of motion and stretching the muscle groups that normally move those joints is called performing passive range of motion exercises, or passive ROM. Passive ROM exercises are intended to help maintain joint mobility and flexibility, not to build muscle strength. It takes participation on the part of the client to build muscle strength, such as when a client performs active ROM exercises. Passive ROM exercises prevent shortening of muscles, ligaments, tendons, and joint capsules, thus halting the development of joint deformities. Deformities are caused by permanent shortening of the muscles, which freezes the joint into a fixed position, resulting in a contracture. Passive ROM exercises help prevent hypostatic pneumonia, thrombophlebitis, foot drop, circulatory problems, skin breakdown, and fecal impaction. They stimulate circulation and sensory nerve endings, increase endurance, and promote a sense of well-being. As beneficial as passive ROM exercises can be for most clients, however, they should be done for others only if the provider specifically prescribes them. Possible contraindications for passive ROM for some joints are acute arthritis, septic joints, a bone fracture, a head injury, a torn ligament, joint dislocation or subluxation, acute cardiovascular pathology, and acute thrombophlebitis. When a client needs passive ROM exercises, a physical therapist might be involved in planning an exercise program for that client, incorporating any precautions or limitations the provider specifies. Together with a therapist, you will ensure that each of the client's joints is safely and smoothly put through its full range of motion. When a client is newly immobilized, it is important to begin a preventive passive ROM exercise program as soon as possible. To perform passive ROM exercises effectively, it is helpful to understand the various terms the provider and the physical therapist might use in designing a specific exercise program for your client. Flexion is decreasing the angle between two bones that form a joint, or bending a part on itself, for example, flexing or bending the elbow. Extension is increasing the angle between two bones that form a joint, for example, straightening the arm. Hyperextension is increasing the angle of an extremity beyond what is normal, for example, bending the hand backward as far as it can go. Dorsiflexion is moving a body part in a backward direction, for example, pointing the toes upward. Plantar flexion is bending the foot so that the toes point downward. Abduction is moving a body part away from the midline of the body, for example, moving the arm outward laterally. Adduction is moving a body part toward the midline of the body, for example, moving the arm across the midline to the opposite side. Circumduction is moving an extremity in circles, such as swinging the arms in a cone configuration. Rotation is moving a bone horizontally. An example of internal rotation is turning the arm inward, while external rotation is turning the arm outward. Pronation is turning the hand so that the palm faces downward or toward the posterior of the body. Supination is turning the hand so that the palm faces upward or toward the anterior of the body. Inversion is turning a body part so that it faces inward, for example, turning the foot so that the sole of that foot faces the other foot. Eversion is turning a body part so that it faces outward, for example, turning the ankle so that the sole of that foot faces away from the other foot. Now that you are familiar with the basic terminology of joint movement, let's review some tips for performing passive range of motion exercises on your clients. First, be sure to check the client's record for any contraindications, and if you find any, make sure there is an order from the provider addressing whether or not to give or how to give passive ROM to that client. You might have to exercise some joints, but not others. Before you begin, you'll explain the procedure to the client and evaluate his ability to cooperate with you during the exercises. Have assistance available as needed. Also, ask the client to let you know if the movements are causing him any extreme discomfort or pain. If the client is confused or agitated, you will need assistance. Throughout the procedure, keep in mind these general guidelines. Adjust the bed to a comfortable working height to prevent back strain. Move the client close to you so that you don't have to stretch or bend excessively. Lock the wheels of the bed to keep the bed from moving as you perform the exercises. Work systematically from the client's head to his toes. Perform the exercises slowly, smoothly, and rhythmically. Jerky movements can cause injury and fast movements can cause muscle spasms. Complete each exercise maneuver 3 times, completing each set of repetitions before proceeding to the next joint. While exercising a limb, support the limb above and below the joint. Never force a joint beyond its usual range of motion. If the client reports extreme pain, stop the exercise and report it to the provider. If muscle spasms develop, stop the exercise temporarily and apply gentle pressure until the muscle relaxes. If the client becomes tired, provide rest periods between exercises. Now let's go ahead and demonstrate performing passive range of motion exercises on an adult client. We'll assume the nurse has verified any provider's orders related to performing these exercises and knows she can proceed with a full battery of exercises for this client. She has also explained the nature of the exercises to the client and is determined that he is likely to cooperate throughout the procedure. The nurse washes her hands, then raises the bed to a comfortable height for her. She begins with the client's neck, uncovering only the area she will be working on as she proceeds to perform each exercise set 3 times. Supporting the client's head with her hands, she flexes his neck so that his chin moves toward his chest, then tilts his head backward and then toward each shoulder. Then she moves to the shoulders, supporting the client's elbow with one hand and holding his wrist with the other. She raises the client's arm above his head, moves his arm across his chest, and then externally rotates his shoulder by moving his arm away from him. Next, she exercises his elbows by placing the client's arm at his side with his palm upward, then flexing and extending his forearm. She exercises his forearm by stabilizing the elbow, then turning the palm downward and then upward. Next, she moves to the wrist. Stabilizing his forearm, she flexes and extends the client's wrist, moves it from side to side, then rotates it. Then she moves to his fingers, extending and flexing them, abducting and adducting them, and then rotating the thumb. Next, she moves to the client's hips and legs. She flexes and extends the hip while supporting the leg and bringing the knee toward the chest, allowing full flexion of the knee. She adducts and abducts the hip by moving the client's straightened leg toward her, and then back to the median and then across the median. She performs internal and external rotation by turning the leg inward and then outward. Next, she exercises his ankles by bending the client's foot upward for dorsiflexion and downward for plantar flexion. She rotates the ankle in a circular motion. Finally, she flexes and extends each toe, then abducts and adducts each one. After this, she will move to the other side of the client's body and, starting at the shoulder, will repeat each exercise she has done 3 times for each joint. After you complete passive ROM exercises, make sure that the client is comfortable. Check his vital signs, lower the bed, and place the client's signaling device within reach. Then wash your hands and proceed to documenting your assessment of the client's range of motion and response to the exercises. Note whether or not the client experienced joint stiffness, joint pain, spasms, or extreme fatigue. Compare your assessment with the client's baseline data and earlier assessments. Record the client's vital signs. If the client is to be discharged and will still need passive ROM exercises, arrange the appropriate home health care or physical therapy referral, and teach the client's family to perform each exercise safely. Make sure family members understand that they must never force a joint through a movement, and that they must stop immediately if the client experiences extreme pain or discomfort. If the pattern of pain with movement continues, they should notify the provider.